Hello, today is Thursday, July 1st, 2021. This is Dr. Rhonda Johnson, and today I'm discussing COVID infections in teens. Now, most of my message today comes from a report that was published by the CDC in their weekly journal. And it was an article that looked at hospitalization of adolescents between the ages of 12 and 14 who had COVID during January 1st to March 31st of 2021 this year. So there were 204 adolescents that they reviewed their hospitalization records, and they were hospitalized for COVID, again, between January 1 and March 31 of this year. And they found that 1/3, 31%, had to be admitted to the intensive care unit. 5% had to have a ventilator breathe for them. We call that mechanical ventilation. Fortunately, none of these teens died. 52.5%, so 50% were women, were female. 2/3 of the adolescents that were hospitalized for severe COVID disease were Black and brown. 31% were Latino and 36% were Black. So that's follows COVID infections in adults. Now, of these 204 adolescents, 70% had one or more underlying medical conditions, with the most common being obesity, followed by asthma. And 1/3 of these kids had no underlying medical conditions and were believed to be healthy, which shows that healthy teens are also at risk for severe COVID disease. So this was before the release of the COVID-19 vaccine for adolescents 12 and up. That occurred in May of this year. And we know that since adults have been vaccinated, the vaccines have been highly effective in preventing hospitalization among adults, because hospitalization rates in adults in the United States from COVID have gone down drastically. So it's anticipated that we should see the same in adolescents as long as we get these teens vaccinated. And particularly for Black and Latino teens and adolescents, it's going to be very important that they get vaccinated to avoid hospitalizations and long-term sequelae from COVID-19, including the multi-system inflammatory syndrome in children. Now, the CDC data has also determined that SARS-CoV-2 transmission, that's the virus that causes COVID, as everybody knows by now, occurs more easily in high schools than in elementary schools, and outbreaks have been associated with high school extracurricular activities. Now, we know that teens are preparing to go back to school for in-person learning this fall. You know, they're going to be resuming fall sports practice. It's July, so I'm sure the football practice sessions are starting up soon. Band practices are starting up soon. Soccer team practices, all those fall sports. So it's important, parents, to get your kids vaccinated. Again, expect that vaccination will reduce the risk for severe COVID disease and hospitalizations. Now, if you don't know where to get vaccinated, you can text 438-829 to find out where you can get a COVID vaccine for your teen, or you can call 1-800-232-0233, 1-800-232-0233, or text your zip code to 438-829. Now, I do want to acknowledge that on June 25th, the FDA added this warning to the fact sheets for the Pfizer and the Moderna COVID vaccines. And it reads, and I'll read it verbatim, myocarditis, which is inflammation of the heart muscle, and pericarditis, inflammation of the lining outside the heart, have occurred in some people who have received the Pfizer COVID-19 vaccine. And most of these people's symptoms began within a few days following receipt of the second dose of the Pfizer vaccine. The chance of having this occur is very low. You should seek medical attention right away if you have any of the following symptoms after receiving the Pfizer COVID-19 vaccine. That's chest pain, shortness of breath, feelings of having a fast beating, fluttering, or pounding heart. So I do hope, parents, you will talk to your teens and their healthcare providers about COVID-19 vaccine. You know, kids want their lives to get back to normal. They want to socialize, go back to school, go to sports events. They want to hang out at the mall. They want to go to parties. They want to do all the things that teenagers and young people like to do. The interruption of school and other normal activities has caused substantial damage to our children, academically, socially, and psychologically. Helping children resume normal activities is important to their health and well-being. Now, we know we're in a time of this highly contagious Delta variant. It's expected to become the dominant COVID variant in the next few weeks, and it's coming to your neighborhood soon. So I want to also level set and acknowledge to parents, you know, the biggest risk to your children's health today is probably not COVID. It's more likely to be things that you have decided long time ago were acceptable, like swimming, riding a bike, doing sports, or traveling in a car. Please use all safety precautions as your teen prepares to enjoy this summer. As always, my views are my own. My only goal is to help save lives during this COVID pandemic. And remember, folks, the best COVID infection is the one that never happens. Stay safe and stay blessed.